been sanitized, so I didn't want to touch it. Okay, go ahead and put your hands right there and start turning. This is, yes, yes. I'm going to do a quick start right there. Keep it going. Okay, and pick up your pace as you become a little more familiar with it. Yeah, there you go. Somebody gets on this.
What if you're not discharged, what would it be at?
So we want it to be between 10 to 15 beats for when you came in. You came in.
I was having severe chest pain, and I wasn't sure why. So I thought it could possibly be symptoms of having COVID. I wasn't too sure. When I woken up, I heard him say that he had to do 5 stents instead of the 1. So the surgery was literally supposed to be 30 to 45 minutes. I was there for almost 2 hours. My first follow-up appointment with Dr. Grace, he recommended for me to do rehab, like a cardiac rehab. And honestly, I did not want to do it. I feel like I'm 33, I go to the gym, I don't have any health problems. So I told him I have to think about it. I was like, I don't know, I have to think about it. And I actually had Bible study that Wednesday, and one of my Bible study members actually worked in a hospital as a nurse in the cardiac department. And she was explaining to me how one of her patients had passed away the day before at the gym. And I was like, what? And she's like, yeah, he decided, he was working out, he was taking it slow, but his heart rate was not being monitored. That next appointment I had, I went ahead and signed up for the cardiac rehab. The benefits to me are, just growth, and very thankful for the monitoring. The staff are very, they give you a lot of information. Any questions or concerns you have, they're there for you. Like I said, for me, it's just growth and building myself back up.
What we do here is monitored exercise. So they actually are wearing a telemetry monitor, much like the one they had on when they're in the hospital. So when they come here, they're used to seeing their heart rhythm, and there's so much comfort in knowing that we're looking very closely at their heart rhythm. So we're monitoring the heart rhythm, the heart rate, the blood pressure, the oxygen saturation, and watching them very close for symptoms. I hear it a lot. They say, oh, I have a local gym, or I can go here for $10 a month. I can do it on my own. But the problem with that is they can tell when their legs are tired, they can tell when they're getting short of breath, but they have no idea how their heart is responding to that activity. And many of the rhythm problems that occur during exercise, patients don't feel them. And we actually we've had to take several patients to the emergency room based just on what we see on that heart monitor. And we caught it before they actually had any symptom at all. So I admire and respect her because she is setting an amazing example for her family and for the rest of us, you know, to take notice when you feel something unusual, and to go to cardiac rehab and follow through with that and get the help that you need.